Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today, coming to you once again from the Senior Botanical Garden in Kernersville. We'll tell you more about them later on, and later on is when the roundtable shows up, and we'll get into all sorts of controversies there, so I hope you'll stay with us throughout the entire half hour, especially because we also have some other great guests and important information coming your way, so stay with us, will you? Where we want to start, though, is talking about cardiac rehab. It's an appropriate month of the year to talk about heart health, and we do that with this young gentleman next to me. Elijah Russell is an exercise physiologist with Northern Cardiac and Pulmonary Rehab, coming to us courtesy of the good folks at Northern Regional Hospital in Mount Airy. Good to see you.
Thank you for having me. Good to see you.
Let's just help us explain this in case somebody knows. What is cardiac rehab?
Absolutely. So cardiac rehab is a medically supervised program. It focuses heavily on exercise, and it focuses really on those individuals who have had, like a heart attack or any sort of open heart surgery. And we just try to help rehabilitate them to get back to their normal life because, after a traumatic event like that, a lot of stress on the heart, it may not function as good as it once did. And our ultimate goal is just to really try to get them back to where they was.
I'm not kidding around with this, but the fact is, some people say, hey, wait a minute, Elijah, I'll just go to the gym, work out myself. But you guys do a lot of special things and take care of people. I mean, it's different.
Absolutely. We always tell people is because they come in, they like to say the same thing, is we actually monitor their heart rate, their heart rhythm. So it's really something that you can't exactly get at a gym.
Right. Now, where would this take place? If I've had a cardiac event, I need to go through rehab, I want to get in touch with you guys, and we'll put up some information on the screen in just a few minutes, but I want to get in touch with you. But if I say, okay, I'm going to sign up for cardiac rehab, where does it usually happen?
So what actually usually happens is somebody has an event, and say a heart attack, like I said, an open heart surgery of some sort, and usually what we get is a referral from their doctor.
Okay.
The referral's faxed in, and once the referral's faxed in, then we make the call and set up an appointment, and then from there we just take the necessary steps to make sure we're setting this individual up the way they need to be set up.
And would they come to a special office or clinic that you're working at, or would they go right to the hospital, or how does that happen?
We have an off-campus site. It's located right behind the hospital.
Very convenient.
Yes, sir.
Very convenient. Now, what are you sort of touched on this before, but what are the overall benefits of cardiac rehab?
So there's many benefits to cardiac rehab. If you want to look at it from a financial standpoint, it's actually very cost effective as opposed, all the medications, which are good, but, it's a very cost effective method of treating any sort of heart disorder. From a physical standpoint, you have lower rates of death, angioplasties, open heart surgeries, and actually there's been shown almost a 50% increase in the 3-year survival rate in those who participate in cardiac rehab as opposed to those who do not participate in cardiac rehab.
Man, that's amazing.
Absolutely.
And you mentioned cost, so let me ask this. Is what you do covered by insurance?
It is. Most private insurance companies, Medicare, Medicaid, they'll cover cardiac rehab. But if you ever have any questions about that or anything, you can always give us a call and we can always check into it for you, or you can just call your insurance provider directly and they'll be more than happy to let you know.
Because as you said, again, this is a medical-based thing. This
Yes.
is not just like going to the gym and working out. This is a very specialized thing where you're working with people and getting them back where they need to be. And it's like a medical procedure kind of thing, and so it's covered in most cases. I want to put up a couple things on screen. You can call 783-8448 if somebody wants to make an appointment. I think that's a general number
Yes,
they can
sir.
call. And then up on screen is a general website that I want to mention, which is a great website, choosenorthern.org, for all sorts of general information about the services and programs that are provided through Northern Regional Hospital, and it's a very important website to check out. Elijah, I can't tell you how glad I am you're here, how important the work you do. You're actually saving lives because you're giving people extra years to enjoy life and getting in shape. And I thank you for all you do.
Thank you, and thank you for having me. It's a privilege to be here.
All right. You come back sometime?
Absolutely.
All right. We'll be right back after this.